Well, the first thing is with locoregional recurrences that occur following prior treatment for breast cancer. Number one, it's relatively uncommon in today's era. So as we've had more effective therapies, both surgically and systemic therapy, the frequency of actually developing either local in-breast recurrences or the more troubling other locoregional recurrences such as in lymph nodes has become progressively less common. That said, when they do occur, it becomes a challenge because you have to hopefully eliminate them by either removing them surgically if possible, and then based on what you find, decide whether or not additional systemic therapy may be helpful to reduce the risk of a problem further down the line. So typically, again, these are not common problems, fortunately. So when they do develop, it's often a consequence of either the patient detecting something in a conserved breast, or perhaps something that was picked up on follow-up mammography, or in the case of a mastectomy, obviously something that's readily apparent on the chest wall. So when locoregional recurrence is detected, it's typically a multidisciplinary kind of evaluation. The surgeon's often the first stop because the decision has to be made as to whether or not surgery is going to offer the first step. And by that I mean if a woman had a lumpectomy earlier and develops an in-breast recurrence, more often than not they're going to get a mastectomy because you don't typically re-irradiate the breast. There are some nuances from a surgical standpoint as to whether or not a patient should have repeat sentinel node biopsy or anything additional should be done. But in that particular situation where there's an in-breast recurrence, a mastectomy is typically done. For the patients that have a local regional recurrence other than in the breast, the decision has to be made with the surgeon as to whether or not they can easily resect the lesion. So if there's a mass in the armpit, in some cases it's very circumscribed, maybe it's easy to get out, but there are circumstances that would make surgery more difficult, and in that setting we often give systemic therapy prior to any type of surgical procedure. So I think, again, it lends itself to the question that there has to be a multidisciplinary approach, although in all these cases, often the first assessment is checking the box, yes, no, can a surgical procedure be done first?